Hello everyone. Today we are going to discuss about male reproductive system part 3. I am Mrs. Jansi, clinical instructor at Triple College of Nursing. The objectives for today's session is, after listening to this video, the listeners will be able to understand the structural disorders, explain the inflammatory disorders, and know the neoplasms of the male reproductive system. Okay, what are structural disorders? We are going to discuss in detail about cryptorchidism, hypospadiasis, epispadiasis, torsion, varicocele, and hydrocele. So let's move on. Undescended testis or undescended testicles is known as cryptorchidism. It is the absence of one or both testes from the scrotum. So this usually represents failure of the testis to move or descend during the fetal development from an abdominal position through the inguinal canal into the ipsilateral scrotum. So what are the causes? Severely premature infants might have this cryptorchidism, low birth weight babies or LBW, environmental chemicals, hernial repair or other surgery in the inguinal area, which results in trapping of the testis above the scrotum, or exposure to a regular alcohol consumption of the mother during the pregnancy, exposure to any pesticides, or if it is a twin pregnancy, then there is a chance of undescended testis. Okay, so hormonal therapy is appropriate medical treatment for this condition. If this therapy is ineffective, then the corrective surgery can be done. That is orchipexy. This is usually done between ages of 5 and 7 years. It involves suturing the testis to the scrotal sac to secure them. Because these clients have increased risk of testicular cancer, they are encouraged to perform routine TSE monthly. Once TSE is nothing but the testicular self-examination. What is nursing management? After orchipexy, ice packs should be kept to the area for the first 24 hours due to or to reduce the swelling. The patients might be advised to wear a scrotal support for some time after the surgery. Prevent trauma to the incision site. So we have to be watchful. Watch out for any signs of bleeding and give appropriate bed rest and limit or restrict the movement until the wound is completely healed, and continue the medications and antibiotics as advised. Okay, hope that is clear. Now we will move on to hypospadiasis and epispadiasis. So what is hypospadiasis and what is epispadiasis? Along with that, we are going to see about phimosis. So urethral meatus, which is located on the underside of the penis, is called hypospadiasis. So it is underside of the penis, and the meatus, which is located on the upper surface, as you see here, is known as epispadiasis. So these are the congenital conditions which are usually repaired surgically at the young age if they are very severe. Okay, so what is phimosis? Men who have not been circumcised at birth can develop a condition known as phimosis. So phimosis is nothing but the foreskin becomes so tight and that will not retract over the glans penis. Injury may also cause phimosis. Circumcision can be relieved. Circumcision can relieve this condition. So this is about hypospadiasis, epispadiasis, and phimosis. Okay, now moving on to the next condition, that is torsion. Torsion of the spermatic cord. Torsion is nothing but twisting. So twisting of the testicle is caused by a spermatic cord, resulting in an interruption in the blood flow to the testicle. So due to twisting, there is an interruption of blood flow to the testicles. Torsion is uncommon and occurs most often in adolescents and young men. It may be caused by bilateral and congenital absence of the lateral attachments of the testis and epididymis to the scrotum. Torsion can follow an activity that puts a sudden pull on the cremasteric muscle, which elevates the testis. So extreme cold, such as jumping into very cold water, may also cause or results in torsion. Occasionally, this is spontaneous that occurs during sleep. Okay, what are the signs and symptoms of torsion? It includes onset of sudden severe scrotal pain, vomiting, abdominal pain, and nausea. This can cause testicular infarction and necrosis if it is left untreated for more than few hours. So immediate attention is required if torsion is observed. So thus it is considered as a surgical emergency. What is a surgical treatment? So hence it is twisted, we are going to untwist it. So the surgical detorsion will be done, and bilateral orchipexy, that is surgical fixation of the testis, are the treatment plan. So if torsion has caused testicle necrosis, then the testicle must be removed, that is orchiectomy. An orchiopexy is then performed on the unaffected side to prevent the torsion of that testis. So it is twisting and we are going to untwist, or detorsion surgery we will do, followed by bilateral orchipexy. And if that is not going to work, then if it is completely necrosed, then orchiectomy will be done, followed by that orchiopexy will be performed to prevent the torsion of that testis. Hope that is clear. Now we will move on to varicocele. What is a varicocele? This is nothing but an abnormal dilation of the testicular scrotum, causing a reflux of blood down to the scrotum when standing or straining. So the scrotal temperature is higher than the normal because of the blood which is pooling into that area. So this may be unilateral or bilateral. However, this condition is more commonly seen on the left side. So what are the signs and symptoms of varicocele? This will cause pain in the testicle or pain radiating to the other side. Symptoms of varicocele also include swelling and nagging dull pain in the scrotum. So this may not be clinically evident until the puberty. The veins become dilated and tortuous, and on palpation are often described as similar to the bag of worms. So varicocele is, when we palpate, we will find bag of worms. So surgical intervention. Correction is done during a number of different types of incisions, laparoscopically and radiographically. Surgical repair of varicocele may be necessary to eliminate or control the pain. Repair can improve the semen count in 60% of the men with infertility. However, if semen analysis is normal, infertile men with varicoceles do not require any treatment. Moving on to the hydrocele. A hydrocele is an accumulation of fluid in the space between the membrane covering the testicle and the testicle itself. So it may be caused by infection, that is orchitis, or an injury. The scrotum enlarges, pain and swelling will be present. However, the client with a hydrocele is often asymptomatic. So here you can see a serous fluid which is covered. So this may be treated by an hydro is nothing but the collection of water or fluid in the space between the membrane which is covering the testicle and the testicle itself. Okay, so this sac requires surgical removal. Pliction, the stitching of the folds or tucks in the hydrocele wall to reduce its size, will be usually prevent in redevelopment of the hydrocele. Fine. With this, we are finishing with the, and now we are moving on to the inflammatory disorders. So the inflammatory disorders are epididymitis, orchitis, and prostatitis. Okay, first thing is epididymitis. What is epididymitis? Epididymitis is nothing but the inflammation of the epididymis. In adults younger than 40 years, Chlamydia trachomatis is often the causative organism, and the condition manifests as a burning sensation or the penile discharge. Infection by Chlamydia trachomatis is considered as a sexually transmitted infection. In older men, gram-negative bacteria are likely a cause. Infection spread from urine, urethra, the prostate gland, or the seminal vesicles. This may follow an infection of a urinary tract or prostate gland. So this can affect man's fertility. What are the symptoms? So symptoms include redness, pain, various degrees of scrotal swelling. The scrotum can enlarge greatly, and the condition can even interfere with the client's ambulation. The symptoms also include chills, fever, nausea, and vomiting. Okay, what can be done? Administer antibiotics as advised, provide scrotal support, and apply cold packs to the scrotum. Moving on to the next condition, orchitis. So what is orchitis? Orchitis is nothing but the inflammation of the testis, and it may result from the infection or injury. Maybe after mumps, puberty may cause orchitis resulting in sterility. Symptoms include pain and swelling in the scrotum and sometimes urethral irritation. A scrotal support is used, and an ice bag application to the scrotum is helpful. Heat application should not be given. We have to give ice bag application. Next is prostatitis. Prostatitis is nothing but the inflammation of the prostate gland and is classified as acute bacterial, chronic bacterial, and non-bacterial. So urine analysis is often helpful in determining the cause of an acute bacterial, chronic, and non-bacterial type. Urine analysis is to rule out the acute and chronic prostatitis. Bacteria and numerous white blood cells are present in the urine. Urine culture and sensitivity is done to rule out the bacteria which is growing. Okay, moving on to the types. What are the types? Acute bacterial prostatitis. Usually, this results from an ascending urinary tract infection such as E. coli. The client with acute prostatitis has a very tender, enlarged, and asymmetrical prostate on digital rectal examination. So the symptoms would be chills, fever, myalgia, general malaise, scrotal and lower back pain, and perineal pain will be there, and pain after the ejaculation. Urinary symptoms includes hematuria, that is blood in urine, and urgency or on urination, or obstructive symptoms such as nocturia, that is frequent voiding at the night, hesitancy, or the dribbling of urine. Treatment of ABP, which includes wide spectrum antibiotics, that is acute bacterial prostatitis, that is ABP, which includes analgesics and sitz baths. Sitz baths will be advised. A urine culture and an ultrasound can be done to determine the cause. Client should receive a long course of an appropriate antibiotic. Okay, now, what is chronic bacterial prostatitis? This is usually associated with a lower UTI. Most common organism is E. coli. The prostate is usually normal on palpation. So the diagnosis is established with isolation of the bacteria from the expressed secretions obtained from the prostatic massage. The client's serum white blood cell count is also elevated. The urine culture is usually negative. However, if the bacteriuria is present, the initial treatment is a short course of antibiotics. If not successful, additional antibiotic therapy may last up to 3 to 6 months. Now moving on to the non-bacterial prostatitis. What is non-bacterial? This is a common form of symptomatic prostatitic inflammation. Inflammatory cells are present in the expressed prostatic secretions, but cultures are negative. Chlamydia and trichomonas have been implicated as possible causative pathogens. Chlamydia and trichomonas have been notified as a possible causative pathogens for the symptomatic prostatitic inflammation, which results in rectal examinations. The results of the rectal examinations will be normal. Empirical treatment of antibiotic can be started. What are the nursing measures for this type of prostatitis? The patient will be advised for warm bath or sitz bath. Remind the client to increase fluid intake to flush out the bacteria from the bladder, and stool softeners can be advised and given to prevent the constipation. So far we had discussed about the structural disorders such as cryptorchidism, hypospadiasis, epispadiasis, torsion, varicocele, and also hydrocele. And we had also discussed about the inflammatory disorders such as prostatitis, epididymitis, and orchitis. Now let's go on to the neoplasms, BPH, prostate cancer, and testicular cancer. Benign prostatic hyperplasia. So BPH is a common condition in which the prostate gland gets enlarged. So the gland begins to grow at adolescence, continuing to enlarge with the advancement of the age. Because of increasing longevity among men, the incidence of BPH is rising in recent days. Most men by the age of 50 years have some non-malignant prostatic enlargement, which is termed as BPH. Because the prostate is a donut-like structure surrounding the urethra and often impinges on the urinary stream. What are the signs and symptoms? The signs and symptoms include growth of the prostate is not harmful, but the symptoms it produces may have a varied amount of consequences. Initial symptoms may be urinary difficulties. The client does not empty his bladder completely when he voids and finds that he must void frequently, often during the night time. He may also find starting to void increasingly difficult or painful and may notice traces of blood in his urine. Cystitis may be a result. What are the diagnostic tests? The condition is diagnosed by an initial PSA with a digital rectal examination followed by urodynamic testing, ultrasound of the prostate, and endoscopy to rule out the prostate cancer. So in severe cases, this will show urine analysis, urine culture, serum creatinine, and blood urea nitrogen can be checked. What is a medical and surgical treatment? It includes watchful waiting until the client is symptomatic. Medications that can be beneficial for these symptoms include dosacin, terazosin, tamsulosin, and finasteride. So prostate size can be reduced by a number of different methods such as simple prostatectomy and transurethral incision, transurethral microwave thermotherapy, and also transurethral needle ablation. TURP is a surgical treatment. So TURP remains the standard surgical treatment for obstructive BPH. The method selected depends on the client and the preference of the healthcare provider. What are the complications? There are two primary complications. So urinary tract infection results from residual urine, which causes decreased resistance to bacterial invasion. Acute urinary retention is surprisingly a common complication caused by obstructive nature of the enlarged prostate. So what is the nursing alert or the nursing consideration? If a client experiences an episode of urinary retention at home, he can try a warm shower or bath to relax the sphincter muscles. Advise him to allow the urine to flow into the shower or tub. If a shower or bath does not work, he should go to the emergency department for immediate treatment. Now, we will move on to the prostate cancer, second one. The prostate cancer is a carcinoma of the prostate gland that may spread out to the other parts of the body, particularly the bones and the lymph nodes. What are the signs and symptoms? Decrease in force and size of the urinary stream, urgency, frequency will be more, nocturia, hesitancy, that is difficulty in starting the stream, dysuria, hematuria, pain in the lower back, pelvis, or the upper thighs. And this is commonly metastasis into the bones, lymph nodes, brain, and lungs. So the bones involved are usually in the region of the prostate, and which includes the lower spine and hips, leading to the symptoms such as backache, hip pain, perineal discomfort, and weakness will be the signs and symptoms observed from the client. What is the diagnosis? So PSA, that is prostate antigen, prostate specific antigen blood test, then the digital rectal examination, biopsy. When we do biopsy, this aids in the diagnosis and also help to determine the Gleason score. So Gleason score is nothing but the sample of tissue from the biopsy are studied in a lab. If cancerous cells are found, then they can be studied further to see how quickly the cancer will spread to the adjacent areas. As I told you, it will spread to the bones and lymph nodes. And then we will also do MRI and CT scan. These are the diagnostic methods. Treatment. The treatment depends on the disease stage and the client's age and symptoms. Options for therapy include radical prostatectomy, radioactive seed implantation, cryosurgery, radiation therapy, or hormone ablation therapy, HAT. And also the treatment may lead to erectile dysfunction in 70 to 80% of the clients. Incontinence is less common after the prostate cancer. Hope this is clear. Now we'll move on to the testicular cancer. So the testicular cancer is the cancer of the testis. So this develops in the testicles. It is more common among the males who is aged between 15 to 40 years. The causes are men aged 15 to 35, hereditary, sedentary lifestyle, early onset of male secondary characteristics such as cryptorchidism, orchitis, and inguinal hernias. What are the signs and symptoms? A lump in one testis or hardening of one of the testicles, abnormal sensitivity, loss of sexual activity or interest, sexual withdrawal, a burning sensation, especially following physical activity, that is heavy sensation, lumbago, that is a lower back pain, an increase or significant decrease or sudden decrease in the size of one or both testes. Blood in the semen will be also noted, and general weakness and tired feeling will be there. Okay, now moving on to the stages. Stage 4 is there. So first stage is the cancer remains localized to the testis. In stage 2, the cancer involves the testis and metastasis to the retroperitoneal and the para-aortic lymph node. In stage 3, this involves the testis and the metastasis will go beyond the retroperitoneal and para-aortic lymph nodes. And in stage 4, if there is liver and lung secondaries will also be affected in stage 4. These are the stages of testicular cancer. This is how it spreads. So what is the treatment? There are 3 basic types of treatment. That is surgery, radiation therapy, and chemotherapy. A surgical intervention is, as earlier we discussed, it is orchiectomy. How can we prevent? So a male, as we told you in the etiology, men who is 15 to 50 years is the high risk for testicular cancer. So testicular self-examination should be done by a male. We can encourage them to do monthly once by self or can be examined by a doctor. So hold on to one testicle at a time, rolling it gently between the thumb and the fingers. You can see the picture here with the thumb and the 2 fingers in between the testicles. The changes to be noted, that is, if you find any hard lumps, if it is smooth or rounded bumps found, and if there is any changes in its size, shape, or consistency. So this should be educated to the person and follow up with this testicular self-examination. We can prevent the testicular cancer. I hope it's clear. So we had discussed about the structural disorders such as cryptorchidism, hypospadiasis, epispadiasis, torsion, varicocele, and the hydrocele. And I hope you understood about the inflammatory disorders such as epididymitis, orchitis, and prostatitis, and also neoplasms such as BPH, prostate cancer, and testicular cancer is clear. These are some of the references which I had referred. I hope the topic is clear. Thank you.